Hi, welcome to the Madrid School of Osteopathy. My name is Guy. Today I would like to speak about treatment in a shoulder problem that can be pain or lack of mobility, but one of its causes is the liver. One of the interesting ways that the liver can influence the shoulder is through innervation. Because from the area in the cervical spine that innervates the shoulder emerges a very important nerve. It's called the phrenic nerve. The phrenic nerve innervates mainly the diaphragm. The diaphragm covers the liver and connects to it with important ligaments. But as well, the phrenic nerve innervates a capsule, a fascial capsule that covers the liver itself. It's called the Gleason's capsule. Because of that, any kind of dysfunction in the liver or the diaphragm can create a facilitation area in the cervical spine that can create a dysfunction in the shoulder. As in osteopathy, diagnosis is the most important. So that's why we're going to do many tests. One of the tests we're going to do, it's called a lift test. We're going to ask the patient to do the movement that generated the pain or its lack of mobility. For example, can be a forward bend. I can ask the patient to do like a movement forward, yeah, and can do it. And then I can do the movement again by doing inhibition for the liver. Do the movement again, 𝗘𝘀𝗶𝗲𝗿𝗀𝗀𝗍. If there was a reduction in the pain or is better mobility, better range of motion, I can suspect that one of the causes for the shoulder pain was the liver. As treatment, we're always going to start by treating the diaphragm. As any other muscle in the body, we're going to start with its innervation. For that, we're going to treat first, as I said, the phrenic nerve. Can you lie on your back, please? For that, I'm going to check the first the cervical spine C3, C4, C5, where the nerve emerged toward the diaphragm. And if I find a dysfunctional hypomobility, I can correct it. After the innervation, I'm going to treat its insertion. Can you sit, please, as like on your horse? One of the most more to the back. One of the most important insertion is in the thoracolumbar spine. For that, I can do a technique of lift off. Flex, more forward. Can you see me? Or I can do a technique as a Freire technique. I can ask the patient to put his hands behind his hand. Flex, right? After treating the insertion, I'm going to treat I can treat the muscle itself. I can do a stretching technique. Can you flex a little bit more, bend? Okay. And I'm going to use the breath of the patient. So I can inhale, 𝗘𝘀𝗫𝗀𝗍, and extend your back, and exhale. 𝗘𝘀𝗫𝗀𝗍, 𝗘𝘀𝗫𝗀𝗍, and exhale. 𝗘𝘀𝗫𝗀𝗍, and exhale. Flex, bend, more. Okay. Can continue con il leve back. State sobre la espalda. De vuelta. Can continue with inhibition for the phrenic center. As well, stay in respiraciones profundas. Do deep breath. I'm going to use the breath of the patient. So inhibition for the phrenic center, for the central tendon. Okay. Un poco más atrás. We're going to continue by treating the liver. As well, I'm going to start with its innervation. The innervation for the liver goes out is the vagus nerve. For example, the parasympathetic innervation of the liver is the vagus nerve. The vagus nerve goes out from the jugular foramen. It's an opening in the cranium that between the occipital and the temporal bone. For that, I can check first the first cervical spine for any dysfunction. I can connect technique. I can treat as well the path of the nerve towards. For the sympathetic innervation, I'm going to do a technique of dog technique. I'm going to check the vertebrae T7, T8, T9, where the sympathetic innervation emerge. Okay, extender las piernas. Underneath. Before doing a direct technique to the liver, we have to treat two important structures. One is the duodenum, is the first portion of the intestines, and the second one is the sphincter odi, is where the bile duct emerges toward the second portion of the duodenum. It's to prevent congestion and to give good drainage for the bile. But I can use the legs as a level. I'm going to give some mobility and stretching and relaxation for the sphincter odi and open the angles of the duodenum. ¿Puedes acostar sobre la izquierda? Las manos. Ponte la cabeza sobre las manos. Sí, cómoda. Bien lateral. Sí, ¿cómo es hacia mí? ¿Hacia atrás? Eso. For direct techniques for the liver, I can do mobilization techniques. For example, I can do rotational technique, anterior posterior. I can use this technique as diagnosis as well, and to give good mobility and elasticity for the soft tissue that covers or surrounds the liver. I can stay and emphasize on the movements that are more rigid or less elastic. Lay again on your back. Acostate sobre la espalda. I can do a pumping technique, or like hailing pumping technique. Can use as well the breath of the patient. Toma aire. Exhala. Toma aire. More. Exhala. Toma aire. Exhala. Inhale. More. And exhale. And I'm going to end the treatment with a functional equilibration of the liver itself.